Hello and welcome to the first video in the Pressure Ulcer Prevention series. I'm Hannah, I'm one of the Tissue Viability Nurses for Leicestershire Partnership Trust. These videos have been created to provide pressure ulcer prevention information, advice and recommendation for patients who have been identified as at risk of developing a pressure ulcer. But what else are we doing to prevent pressure ulcers? Staff within the Trust are trained on pressure ulcer prevention, which is provided by the Tissue Viability team. The Tissue Viability team also lead on ongoing Stop the Pressure campaign. There are regular updates provided to staff, opportunities for staff to be involved in bite-sized training sessions, discussions about pressure ulcer prevention, and a 24-hour access to pressure ulcer prevention resources. We're also in the process of setting up a patient-facing website as part of this campaign. This will give you resources and information about pressure ulcer prevention at your fingertips. Patients coming into the care of the Community Health Service will have a thorough assessment, which includes a pressure ulcer risk assessment. Currently, the assessment uses a validated tool called a Waterlow. This gives a numerical score. The score of 10 indicates that you're at risk of developing a pressure ulcer, 15 or more indicates you're at high risk, and 20 or more places you're at very high risk. If you're at risk of developing a pressure ulcer, a personalised pressure ulcer prevention care plan will be started for you. A care plan is an instruction to the other nurses and care professionals and include details such as what pressure relieving equipment is in use, how you are repositioned, and how often. If you require any dietary advice or supplements, amongst others. This care plan is usually reviewed weekly or monthly depending on your level of risk. Your nurse or health professional will be also completing the ASKIN bundle. ASKIN stands for Assessment, Skin, Surface, Keep Moving, Incontinence, Nutrition and Giving Information. This means that the nurse will review your assessment and ask you if anything has changed before looking at your pressure relieving equipment, repositioning regime, and how you are going to the toilet and if there is any moisture concerns, or your nutritional needs. The nurse will also explain any individual risk factors that you have, your risk pressure areas, and how to reduce your risk. They may also need to provide information to people who help look after you, to help them understand why it's important and how to do so. This may be relatives or carers, either your home or residential care setting. We also provide training on pressure ulcer prevention to residential care homes. There is a dedicated website where our relevant pressure prevention resources will be available. As part of completing this ASKIN bundle, you'll be asked if we can check your pressure areas. If there is any sign of pressure damage, a new specific care plan will be started for this area, with instructions to others on how to treat it. However, you may be able to self-care, and this is something to be discussed with your healthcare professional. Depending on the severity of the pressure ulcer, this will be reported to the incident within our trust. This helps us to keep an eye on trends within the areas. Category 4 pressure ulcers that have developed whilst in LPT care are investigated. A pressure ulcer investigation includes looking at care which has been provided and helps us identify where we can learn and improve. You will be informed if your pressure ulcer is being investigated and be offered feedback following the investigation. You can find out more about the campaigns of pressure ulcer in other videos and what is pressure ulcers and how they happen. We have developed this leaflet for healthcare professionals to give anyone identified at risk. You may also find the needs some extra support to discuss your risk. If this is the case, a nurse or a healthcare assistant may go through the leaflet with you and there's space for you to make notes within the leaflet. Please do read the leaflet, and if you have any questions you could write these down and ask your health professional. We've told you a little bit about what we're doing to help you find out more and understand what you can do. Check out our next videos in this series that focus on different elements of the ASKIN bundle. There is also further information for patients and carers on these websites.